Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey?
Oh, Dad!
Tim!
I need an ambulance.
Hello, how are you? My name is Dr Mostafa. I work in one of ICU in Kenya, but originally I'm an Egyptian doctor. I got my medical degree from Egypt. So I hope you have noticed this video I have introduced to you to explain a little about stroke and how we can suspect about it. Okay, this video and the next videos, by God willing, it will talk about emergencies and critical condition that we can early detect. And early detection, it means save lives and decrease complications. So our first video will talk about stroke. What does mean stroke? Stroke, it is diminish or stopping of blood supply to one of our brain areas, either by clot to one of main vessels of blood of brain, or by hemorrhage and bleeding affect one of the blood vessels in the brain. So what is the symptoms and signs? There's many things, okay, and we are not here to talk about generally ischemic stroke or stroke. We are here to know how early detect and what we should supposed to do to when we detect or suspect about stroke and why it is important. So we have what we call the window for thrombolysis, or time between starting of stroke and how long I have before I give medication called thrombolysis. From its name, it is causing lysis or dissolving to the clot. By doing that, I preserve many function of the brain and can save life of this patient. So how I can this window, how long it can stay? It can be up to 4.5 hours. So if I catch early, I can handle this condition as medical team and give this medication for a patient who has clot and preserve many of his brain function, and also can save his life if his condition is critical. So or there's other management so important, like for example, maybe I will not use this medication, but maybe if I catch early, I prevent secondary complication. Like when we have problem in the brain, we could have increased pressure inside the brain. So medication and management to decrease this pressure will decrease more damage and maybe even stopping more damage. And this cannot be done except in a hospital. So once I have a patient, I suspect I have a stroke with him, either a friend or a family member, I have to rush to the closest hospital with favorable with CT scan available, or I call ambulance. They can guide me, and in the description I have put a link for an application that you can connect direct to one of the ambulances, or also there's a phone number you can use. You can use whatever phone number or for any ambulance, or connect with any ambulance. The key here is how quick you do that. So first of all, as we see this patient in that video, there's a test, or there's a method we can recognize stroke. It's called FAST. Okay, F for face, A for arm, for speech, and T for time. So when I see weakness in the face, like we see in this video, about dropping of eyelid or dropping of the lips of the mouth, this suddenly happened. This is a very strong sign, especially in old people, that we need to rush to hospital and call emergency. Also arm weakness, if patient is carry something and suddenly dropped from him, or he cannot carry, or he cannot walk suddenly, in patient with history of especially hypertension and diabetes, this is also the time that I have to rush. And this for speech, as we see, this patient is not able to speak, or he's saying some slow words, or speaking some words that you cannot understand. If this happens suddenly, so the best way is to hurry as much as you can to a hospital. Whatever private, public, doctor will know how to handle, because the key here is rapid management for number one, to prevent the main problem. Like if there's a clot, we give thrombolysis in the time, or to dissolve the clot, or if it is hemorrhage, maybe it is need urgent surgery. And secondary, intervention to prevent more damage to the brain by decreasing the intracranial pressure or the pressure inside the brain, which this pressure can cause more damage to the brain. So I wish all of you a good health, and to your people and your relatives and the people you love. And I hope I would help you to recognize the sign that once you see, it tell you that it is stroke or problem in the brain. And the key here to remember, number 1 and 2 and 3, to rush to closest or nearest medical facility or with health facility with CT scan available. Thank you, and have a good day.